Welcome back to the Imperfect PCOS podcast. Today, we are joined by Cara Clark. She is a registered nurse and hormonal acne specialist, teaching women how to transform and love their skin. She immersed herself in the world of skincare and self-care from a young age due to her own skin struggles and became passionate about sharing this knowledge with as many people as possible. Because of this, she became the self-care nurse on social media. Cara educates daily on acne solutions, hair loss, skin tips, self-care, dermatology, and showcasing beauty products that she loves.
You're listening to the Imperfect PCOS podcast, where we share no BS science-backed strategies to put your PCOS into remission. I'm your host, Corey Ruth, aka the Women's Dietitian. Let's get into it.
Welcome, Cara. I'm so excited for this chat today. Thank you for joining us.
Thanks for having me, Corey. I feel like I've followed you forever.
Stop. Keep going.
PCOS is really near and dear to my heart.
Yes.
So I'm so excited. Thanks for having me.
Yes, that's so cool. I literally everything you say, I'm like, okay, what does Cara think about that? Because, yes, I work in healthcare, but, I work in the dietetic side. So,
right.
The kind of the beauty product side, the more topical piece to things like skincare, I'm kind of from the inside out. So it's really awesome to have you as a resource. And I know this is going to be of such great interest to all of my listeners, not only those who struggle with PCOS, but those who just kind of are, working on things like hair loss and acne, which can have other causes. So first of all, you're pregnant. When are you due? So exciting.
My due date is Halloween.
Wait, okay, stop. Because we were just talking about how I felt like I was in your position like 4 years ago. My daughter's due date was Halloween. Yeah.
No.
Yes. No. Yeah.
Okay,
she was born on the 27th. She came early. She was 6 days, or my water broke 6 days early. Yeah.
I'm so curious to see if it's gonna come early or gonna come late. It'd be really fun to have a birthday on Halloween too.
Right?
It's a fun time.
I love it. Yes, all of her parties, we do like costume parties. It's just super fun. That's so cool. Okay, so twinning. Yeah, we'll see when baby comes. Awesome. Yeah. Cool. And I want to, I really want to first, because I always love to connect kind of the backstory and, how somebody got into the field that they are in. Tell us about your personal journey with your skin and how you got into kind of working in the dermatology side of things.
Yes. Okay, so like many people who are skincare obsessed, like myself, usually starts from a reason or a pain point. And for me, that was acne. And mine started really young. It was probably 5th or 6th grade. Wow. And I started developing really intense, inflamed, cystic acne. And anyone that has this type of acne knows that it just takes over your entire life in every aspect. So I became obsessed with learning what I could do to treat it and how to improve it. And that's also when I was introduced to dermatology. I started seeing a dermatologist for the first time. And eventually I had this goal in my mind, like, okay, it'd be so amazing if one day I could treat my acne, work in dermatology, and be able to help others do the same.
Yes.
So that was my whole goal, and started researching about skincare and hormones and why my skin was reacting like this in the first place. Eventually went to nursing school and got my BSN and was able to work as a dermatology nurse. And learned a lot from that. I really like to focus on hormonal acne because that's what I went through. And then I kind of developed my own little method and philosophy behind it, because in the dermatology world, it's a lot of topical based, and we really don't talk about diet, lifestyle, things like that. So I've kind of formed my own little philosophy, mixing the two together. And eventually I started Cara Clark BSN, and I coined myself the self-care nurse.
Perfect. It works.
Yeah. And it was so fun. I now get to teach about hormonal acne, and I teach about hair loss, something else that I've gone through as well. And I am living my goal, thankfully, and I get to do it all from home, and it's amazing. So that's kind of the origin story to how
I
I
love
came to
it.
where I am now.
Oh, I love that. That's just so amazing that you've come full circle. I absolutely, I
Thanks.
appreciate that so much. And, we talk about skincare and hair, and those
Mhm.
two things can sound, what am I trying to say? What's the word? Like surface level, like all about
Yeah.
aesthetics. But my gosh, no, it comes down to, hair and skin is
Mhm.
confidence.
Yep.
And, you don't know how incredibly eroding these things can be to self-confidence
Mm.
until you have gone through them. Totally
Yeah.
hear that. Yeah. Has skin and hair changed for you during pregnancy?
Yeah, a little bit.
Little.
To that point of what you're saying, it's so interesting how our skin and hair can affect our mental health, our hair identity.
Yes.
Specifically, when I was having hair loss, I
Mm-hmm.
didn't realize how much my hair was my identity.
Yeah.
And that's kind of what,
Right.
as women, we're conditioned. You look at men in
Yes.
Hollywood, and men can be bald, and they're
I
still like
know.
sexy and
Sexy.
perfect.
Yeah.
Yeah,
Right.
so that's been hard during pregnancy. But if my
Yeah.
hormonal acne and hair loss has taught me anything, it's taught
Mm-hmm.
me to, how do I say this? I will always appreciate the hair that I have and the skin that I
Yes.
have, even though it's never going to be perfect. So,
Yes.
yeah,
Oh, a moment for that. Yeah.
there's been some lovely changes that aren't actually lovely, and I'm prepping now for
Mm-hmm.
possible postpartum hair loss. But
Mm-hmm.
it's really great having the knowledge. I guess the one good thing about going through it in the past is my personality and how I've just researched and become obsessed, because now I have the confidence. If it happens again, I'm going to
Mm-hmm.
be okay. I know what to do to
Yes.
treat it.
Yes.
And it's empowering, at least. Yeah.
Yes. Oh, so true. So true. And I felt that with, subsequent, like my second baby versus my first. I had
Hmm.
no idea how bad postpartum hair loss. I thought I'd shed a few hairs. I had to
Right.
buy a robot vacuum to keep up. I'm not kidding, to keep up with how much hair I lost. And it was so
Oh.
devastating. And I was like, is this normal? For me, it was. And it happened
Hmm.
again with my son. And at least I was primed mentally to know
Right.
it was going to happen. But yeah, sometimes it's like a sneak attack, and that can be just even more, all consuming
Hmm.
and devastating. Talk to us about PCOS specifically and hormones and skin. Like what, and I can
Yeah.
always chime in too, but what is it that you have learned about hormones and how it affects things like acne in our skin?
I'm really excited to hear your take on this.
Yeah.
With my own thoughts, a lot of that being my own
Uh,
experience, because I've
sure.
had PCOS like symptoms, although I've never
Yes.
officially been diagnosed. So that's
Sure.
interesting.
Yeah.
But there's a clear connection that I see, and that's also why I help a lot of people with PCOS with their acne.
Mm.
And with PCOS, we see those hormonal imbalances that maybe the average person
Yes.
doesn't have.
Hmm.
So a couple that come to my mind are the high androgens, aka
Yes.
testosterone. We
Right.
could see the high cortisol, high stress hormone. We can also
Yeah.
have the blood sugar imbalances. All those things can contribute,
Hmm.
but the main one that I think about most is the high testosterone, because
Yeah.
when we have elevated testosterone, that will directly affect the production of sebum in the skin.
Yes.
Sebum is oil. So
Mm.
it's kind of that perfect storm. You have these hormones that are
Yeah.
driving it, and then
Yeah.
you have the inflammation and the increased oil in the skin.
Yeah.
And that's why so many people have breakouts, especially with PCOS, in the cheek, chin, and the jawline
Mm-hmm.
area. So that's always an
Yes.
indicator to me that, okay, yeah,
Got
this is
it.
the hormonal
Got
factor.
it.
Yeah. What have you seen?
Yeah, fascinating. I agree with everything you said. I think bringing in the stress and the inflammation piece is often missed. And I think,
Mm,
we really focus on the testosterone piece, which is, yes, I would say like the main driver,
right.
but we can't deny how much something like stress and inflammation can exacerbate literally every health condition
Hmm.
in our world. So it
Yep.
doesn't, it's no surprise that it can totally wreak havoc on our skin, if not in addition to elevated androgens, just on its own.
Hmm.
So what are, and this is such a tough question. I get this is
Yeah.
I feel like when someone asks me, what are your top tips for PCOS? I'm like, how much time do you
Where do I
have?
start? Yeah.
How many days do you have to talk about this? What would you say your like top 3 tips for skincare when it comes to something like acne? If someone's struggling listening to this and they're looking for more answers, maybe something that they haven't tried. I'm always like, what's Kara talking about? What are her skincare tips? What would you say for acne and breakouts?
Okay, if I could simplify it down to 3
Yeah.
like you, yeah.
Yeah.
First would be obviously skincare. Skincare can take you really
Yeah.
far in treating the
Mhm.
acne you have. So
Okay.
my tip for that would be to create a skincare routine that's personalized to your own skin.
Mm.
Everyone's skin is different, so
Mhm.
make sure it's something that you'll stay consistent with, that you
Okay.
really like and is good for your own skin,
Okay.
that has acne fighting ingredients in
Okay.
it.
Okay.
So something like a benzoyl peroxide, a salicylic
Benzoyl
acid,
peroxide,
that will
silica.
take you really
Okay.
far.
Mm-hmm.
The second tip that kind of goes hand in hand with this is not just focusing on the skincare, but also looking at the internal, looking at the root cause of
Okay.
why your acne is happening, which is big with hormonal acne because
Yes.
hormonal acne isn't caused by not washing your face. It's not because you're
Right.
unhygienic. We
Right.
have the hormones that are triggering this cycle. So if you
Mm-hmm.
can figure out the root cause, if you have PCOS, that could mean
Right.
working with a PCOS specialist like you and getting
Mm-hmm.
blood work and really working on supporting our hormones.
Right.
And those two things together, the skincare will help treat, focusing on the root cause that will help prevent and sustain the results that you have.
Awesome.
And number 3, this is my tip that goes for everyone, not just for acne, but if there's one thing you could do to improve your skin starting today,
Yeah.
if there was one product, if I could only use one product for the rest of my life,
Oh
it
my
would be,
God, what is it? I'm like, am I using
yeah, it would
it?
be wearing sunscreen
Oh,
every
yes.
single day.
Yes.
So,
Yes.
and that's all I'll say. I'm just going to say wear your sunscreen every day, and I promise you will
Mm-hmm.
see results. Although I get it, it's hard. Some people are like, oh, I haven't found a sunscreen I like. I promise there are so many good sunscreens out there. And once you find one you really love, you won't want to go a day without it. And you'll
Mm.
start seeing amazing improvements in your skin.
That's so cool. And yeah, I know when
Yeah.
I think of sunscreen, I think of like greasy, slathering, like when I'm
Mhm.
already hot, like hot and like
Yeah.
half burnt. Okay, so there's definitely alternatives out there. That's amazing. What about for things like preventing like fine lines, wrinkles,
Mhm.
and I maybe am asking this selfishly because I'm in my mid 30s now.
I
So
don't see any fine lines.
oh, so it's the lighting. Yeah, what about, these are inevitable for us. So like
Yes.
what about something like that? Like what would we look for in like a high quality product as far as like a
Okay.
topical along with
In
sunscreen?
terms, yes, in terms of specific skincare concerns,
Mhm.
I would say definitely figure out your concern first. So if it's fine lining and wrinkles, and connect that with the type of skincare active, that will help. So my
Okay.
always go-to for this is a retinol.
Mm,
And
yeah,
whenever my friends come to me and they're like, hey, I'm thinking about getting Botox, I have these wrinkles and fine lines that are really bugging me.
right.
I don't let them even consider getting it until they're using a retinol.
Okay.
So, retinol will literally transform your
Mm.
skin. It's amazing.
Ah,
And it's very likely if you're wanting to get Botox, use your
mhm.
retinol and you might not even want it
Oh my
anymore after
gosh, that's
using it.
powerful. Very
Yeah, the
cool.
other the other thing, a lot of time we see fine lines and wrinkles when our skin is dehydrated. So just making
Mm,
sure we have really hydrating
yes.
products in our routine, and it's
Okay.
very possible you'll see less of that.
Very cool. What
Yeah.
about, I've heard a lot about like a vitamin C. Is that
Yeah.
something else like more on the wrinkle fine line side versus
Hmm.
acne? Okay.
Vitamin C and retinol, those are my two
Okay.
favorites. And combined
Oh,
together, they can just do wonders for your skin. So vitamin C in the morning, retinol at night.
okay.
That's the perfect combo. So I think of retinol kind of as your nighttime refining the skin. It'll refine your skin
Okay.
overnight.
Got
Vitamin
it.
C is going to protect your skin during the day. So
Oh,
it's the
okay.
perfect combo.
Oh, the magic duo. I love it.
Yes.
Very cool. What about something like dry skin, eczema type of situation? Are there specific things that you recommend for that?
Yes. Dry skin, again, using really hydrating products. So
Okay.
using a toner in your routine could be great, using a
Oh.
hydrating serum. A
Mm-hmm.
really fun trick that I like to do is called slugging. Have you heard
Mm-hmm.
that?
I have, and I have no idea what it is. Like, what the hell is it? But yes, I've heard of it.
Yeah, slugging can be really great for dry skin. Basically, at the end of your routine, it's putting a layer of, you can do Vaseline or a facial oil, and it acts
Oh.
as that protective layer to hold all of your skincare
Oh.
products in and
Okay.
prevent dehydration.
That's
So, slugging
cool.
can be really great for dry skin.
Yeah.
For eczema, I really love products that have colloidal oatmeal in
Mm-hmm.
it. That can be really
Mm-hmm.
soothing. And then trying to avoid really hot water when you're washing your
Mm.
and when you're
Okay.
taking a shower. That can definitely aggravate
Oh.
things.
Yes, dang it. I love like a good like Satan sauna when I
I know.
shower, but I
Me
get
too.
it. Yeah.
There's no way around it. PCOS is complex and multifaceted. What we know about it, including how best to treat it, is constantly changing. That's why I've dedicated my life's work to helping women put their PCOS into remission. Inside my signature program, the PCOS Boss Academy, women lose weight permanently without restriction and master their most stubborn PCOS symptoms. If you're looking to get pregnant or want to be a mom in the future, my ultra successful Get Pregnant with PCOS program supports moms to be every step of the way in conquering PCOS symptoms and bringing home the baby of their dreams. Plus, there's an additional weight loss mode to check into. These are all of the science-backed nutrition and lifestyle tweaks you need to improve your PCOS and change your life from a qualified healthcare provider and leading PCOS expert in the field. Ultimately, we are in control of our PCOS, and I would love to work with you inside one of my upcoming programs so you can step into the best version of yourself and start feeling like you again.
What are some skincare products that you are loving now? I mean, obviously we're not going like ham on the branding, but I mean, I think it's great to point women in like the direction, there's just so many things out there. And I
Yes.
speak from experience because again, am not like fully immersed in this world. And when I look at like potential products, I'm like, which one do I get? There's so much good stuff. There's so much crap. Like, how do we know? What to look for, what are some things that you love?
Yes. Skincare can be really intimidating
Yeah.
for sure. And it doesn't have to be the basic you can start with is just cleanser, moisturizer, SPF. Um,
Mm-hmm.
once you have those basics down, that's when I start to say, okay, let's add in some skincare actives that can start working towards your skin goals or treating a specific skin concern.
Okay.
So I've mentioned retinol, I've
Yeah.
mentioned vitamin C. Those are two top ones. I
Okay.
also love a exfoliant, using an exfoliant twice a week.
Okay.
And I prefer using an exfoliating acid
Mm.
over just a physical exfoliant scrub
Oh, interesting. Okay.
because the acids, it sounds scary. It's not scary. it
Whoa.
it will really get into your skin and clear out your pores on a deeper level. So, if you
Okay.
have blackheads, using an exfoliating acid will just nix them all together.
Okay.
Yeah, and I use a lot of different products because
Yeah.
I'm obsessed, but
Yeah.
there's so many good budget-friendly options you can get over
Yes.
the counter at Target. And then there's
Nice.
also some great medical grade
Not,
products that are
yes.
expensive. I would say you can see results with both. I would say
Okay.
invest in maybe those actives that I talked about and
Okay.
really treating a skin concern if you're going to
Okay.
spend more money, and
Right.
then choose a more budget friendly option for the basics like a cleanser, moisturizer,
Okay.
sunscreen.
Okay.
Hmm.
Do you have like a couple brand recommendations like from Target or
Yeah.
Some of
Mhm.
the more medical grade if somebody's looking for that.
Yes. Okay. From Target, off the top of my head,
Yeah, put you on the
Naturium.
spot.
Naturium is amazing.
Naturium.
Naturium has a ton of those actives that
Yeah.
you used to only be able to get
Okay.
really fancy, expensive brands. So
Oh,
Naturium,
love it.
I love CeraVe. I
Mm-hmm.
love Versed. I love Bioderma. Those are a few
Mm.
you can look at Target.
Okay.
My
Awesome.
medical grade ones that I usually go for, I love SkinCeuticals and Skin Medica.
Mm.
Um, what else? There's Is Clinical, and then there's also the in between, like you can get at
Yeah.
Sephora. So
Yeah. Okay.
from Sephora, I love Caudalie, I love Kiehl's,
Mm-hmm.
uh, Dermalogica, and Beekman
Oh, yeah.
1802. Those are at Ulta. So
Okay. Good to
yeah,
know.
it's a lot.
Yeah, that's good to
You kind of
know.
have to play around and find what's best for your budget and your
Yes.
skin type. So take
Right.
it slow. Take it slow.
Yes. Yeah, there's definitely things that I would want to splurge on and others that I'm like, yeah, that's not my top priority.
Mm-hmm.
So I'm gonna kind of dial it back there because,
Yeah.
mama needs to put food on the table still. So
Yeah.
yeah. Oh, that's great. Thank you so much for those suggestions. I know a lot of
Yeah.
us have access to, a Target or something nearby. So
Yes.
cool. And how, we talk a lot about like hormone friendly products. Are
Mhm.
there like things, a few big red flags that you know of that you're like, okay, that's not going to be a product I would recommend? Because again, like there's just such a wide range of information out there. And again, so many products that we're oftentimes like, what is actually considered, air quotes, safe for me to use? I mean,
Right.
we're absorbing it. So
Right.
yeah,
Okay.
scary.
With clean beauty,
Hmm.
I I'm definitely not on the side of only using clean beauty products. Although
Okay.
there's so many clean beauty brands
Yeah.
that I use and love.
Yes.
As far as my research has gone, I
Mm-hmm.
have not found that there's one skincare product that I
Mm.
use that will directly negatively
Got
affect
it.
my hormones.
Got it.
So I still love using clean beauty brands, but I'm
Yeah.
not limiting my routine to that
Got it.
only.
Yeah. Good to know.
However, just something to think about. So, for example, with a clean beauty brand, they
Mm-hmm.
might not have preservatives in their products, which you're like, okay, great. But then if you go and buy a clean beauty product 2 months down the road, that it might be growing mold. So
Yeah.
there's
Don't want
nuance
that
to
either.
everything.
Yes.
Yeah, there's
Very
nuance to
true.
everything.
Right.
Um, but I totally respect if someone
Yeah.
only wants to go clean beauty. So if that's
Sure.
the case, I would recommend literally just going on Instagram and TikTok. There's so many amazing creators that
Mm.
only use
Focus on that.
non-toxic products.
Yes.
And then I also direct people to the EWG
Yes.
app, which I'm sure you've
Yeah.
seen and know about. And you can have it on your
Yes.
phone and look up a specific product, and it will tell you what ingredients you should watch out for and what the rating is for that
Yes.
product. Mhm.
Totally. I've been known to like walk around Target with my app, with
Yeah.
my like looking up different things. People are probably like, wow.
Yeah.
But it's a
Yeah.
great, yeah, that's a good resource. Yes. Cool. Okay. Awesome. I wanted to talk about skin and then I actually do want to just really quickly touch on hair loss too, but
Yes.
how does skin change throughout our cycle? Is that something that's kind of standard or like why do some people notice more acne around ovulation or like their
Hmm.
period? That does for me at least, I do notice that it can flare around that time.
Yeah. Everyone's a little bit different, and
Yeah.
women as cyclical creatures, our hormones are
Yes.
constantly fluctuating throughout the month.
Mm-hmm.
So, the most common one that I see in terms of acne breakouts, I
Mm-hmm.
see a lot of this happening right before someone's period starts because this is
Yes.
when estrogen drops. I think of
Right.
estrogen a lot of the time as that skin happy hormone. And when estrogen is low, testosterone is higher. So, like we talked
Yes.
about previously, the
Mm-hmm.
testosterone and the skin, they don't always bode well together.
Yes.
Um, but everyone's a little bit different. So what I usually recommend for this is taking your calendar or taking your period tracker and starting to track your skin symptoms
Oh,
all throughout your
yes.
cycle. So
Great
some
idea.
people, their skin can be like glowing and beautiful during ovulation, and then some people can
Yes.
break out during ovulation. So tracking and starting to notice when your skin triggers happen throughout your cycle, that can be really helpful, and we can
Totally.
figure out when that's happening for you and your own hormones and then
Yes.
take action towards it. Yeah.
Yes. I love that idea. That little journal is so powerful.
Yeah.
Yes. Yeah. And that also, comes back to managing those hormones that we have out of whack, like testosterone, and, cortisol, all of these things.
Yeah. Easier
Yeah.
said than
I
done.
know. Right. Totally. I know. It's definitely a journey. It definitely is. It's not something that we
Yeah.
can like completely clear up overnight. I wish we could Amazon Prime it, but
I know.
yeah.
Maybe one day.
Yes. Let's shift gears to talk about, since this is something that you specialize in, to talk about hair loss. And if somebody's experiencing a noticeably larger amount of hair shedding, hair loss, hair thinning, it's scary. What
Yeah.
is like the first thing they would do to, get on the path to working on reversing that? What's the first thing that women should do? And I get so many DMs. Like I literally, people send me pictures of the hair that is falling out. And I'm like, okay, like this is a whole, I can't address
Yeah.
this in a DM. Like we have to go deeper. What do you typically do? Like first step?
It's so hard.
So hard. I've been there.
For Yeah, definitely been there. And when I think about
Mm.
mine, my similar to hormonal acne, it's okay, what's
Mm-hmm.
the root cause here?
Yes. Okay.
So when I started having my own hair loss, I looked at all the possible triggers.
Yeah.
And when I looked back at all the triggers, I ended up realizing I had not just one, but I had like 7 different
Oh,
triggers
great.
that were all
Where do I start?
contributing. Yeah.
Yes.
So there's a lot of them. Some that I see are starting birth control, getting off birth
Mm.
control.
Oh,
Obviously,
interesting.
PCOS, or if you don't know, if you aren't diagnosed, it's
Yes.
possible someone has PCOS symptoms,
Uh-huh.
and that could be an indicator.
Mm-hmm.
Yeah, so many different things. Getting COVID can be one of them.
Yes. Yeah, I heard that.
If I could give beyond that 2 big tips for hair loss, it would be to start using a hair growth serum. This
Okay.
isn't going to correct, and stop the hair loss from happening,
Mm-hmm.
but it's going to help stimulate the hair follicles and try to get more hair growth.
Okay.
And then also taking a hair growth supplement, or
Okay.
taking supplements, and making those lifestyle changes that will help support the hair. Because with hair, when you're losing so much hair, at the
Mm-hmm.
end of the day, hair growth requires energy to
Yes.
grow.
Right.
So, like always, I feel like a broken record. We have to start at the root.
Yes.
We have to lower stress, and we have to figure out why it's happening before we can take action. And then, depending on where
Mm-hmm.
that trigger is coming from, everyone's action steps are going to be a little bit different. But
Mm-hmm.
everyone can definitely benefit from using a hair growth serum and then
Mm-hmm.
some form of hair supplement.
Got it. Yeah, those are great tips. And yeah, figuring out what's driving it is number one. So,
Always.
yeah, you can get some lab testing done. Are there labs that you would typically recommend if somebody's dealing with acne or hair loss?
Mm, Probably the same ones that you recommend
Okay.
for your
Yeah.
clients. Yeah.
Okay. Yeah.
Looking at the sex hormones,
Mm-hmm.
doing a full blood panel, although not all doctors will do a full blood panel.
Yeah, I
Um,
know.
Iron, vitamin D.
Mm-hmm.
I'm trying to think. I
Yeah.
remember wanting to get blood work done for mine and wanting to do some of the more extensive ones, and it was a battle. And the thing with blood work too,
Yes.
with hair loss, I was losing hair like crazy, and all my blood work came back normal.
Oh,
So,
shocker.
yeah,
Yes.
so
Right.
getting blood work is for
Mm-hmm.
sure like, okay, check that off the list. and
Right.
you're not crazy if everything comes back normal, because sometimes
Right.
blood work can just be a snapshot
Yes.
of what's happening right
Totally.
there. It's not the full picture. So
Right. Yeah. And
yeah,
there's,
that's the
you
hard
can't
part.
just get like your past work stress
Yes.
results in a blood test for an
Yeah.
average over the last 3 months. Yeah,
Yes.
totally. I know we have to consider, other things. You can get your thyroid checked. I always recommend vitamin
Mhm.
B12 as well.
Yes.
Iron, vitamin D, testosterone. I like to look at blood sugar, fasting insulin, glucose,
Yes.
A1C, just to kind of see if that's potentially playing a role in its, insulin resistance and PCOS. But
Yep.
yeah, you have to consider something also, stress, trauma, surgery. These can
Mhm.
all trigger hair loss too.
Yep.
So definitely something to, look back on and say, has there been any big stressor, physically or mentally, emotionally that's happened? I know my dad, he passed away just totally unexpectedly in 2016, and
Mm.
literally like 3 months later I started losing hair, and I couldn't
Oh,
figure it out because I didn't know about that connection. And it
yes.
wasn't until I started digging into the research, saying, oh my God, this really is real. Okay. I felt like
Yep.
I was losing my shit. I was like, okay, am I going crazy? Like, I feel like I'm losing a bunch of hair, but I'm also still in this, big grieving period. And it was like, adding insult to
Yes.
injury. It was so hard, but I wish we knew more about that connection between like stress and trauma, and how our body is not going to prioritize, growing thick, healthy hair at that time.
Mhm.
It's really working kind of in survival mode. And yeah, I think another, one thing that you said, which stood out, was stopping birth control. That in and of itself can potentially trigger hair loss. But also, if you've been taking birth control, you might have been covering up something like acne or
Mm.
hair loss that could have been a result of PCOS, and you could have never realized it.
Yep.
And then all of a sudden, yeah, you're like, wow, okay, I'm having PCOS symptoms, but I've never
Yep.
had a diagnosis. So that can kind of happen too, where we've been sort of, covering it up with synthetic hormones that have been kind of acting as this band-aid.
Mhm.
And we rip it off, and then boom, all of a sudden, all these
Yep.
problems pop up, literally.
Yeah.
Yeah.
What you said
Mm-hmm.
too, I see that really, really often, of
Mm-hmm.
hair loss starting a couple months after some type of
Yes.
event.
Yes.
So, like talking to my friend, like, oh, I got my IUD in a couple months ago. Oh, I
Uh-huh.
had surgery a couple months ago. There's
Mm-hmm.
something about that 2 to 3 month period
Yes.
where the hair cycle shifts.
Yeah.
Mostly what I see is the hair cycle causing the hair loss. It's when the hair is in the telogen phase, which is
Mm-hmm.
resting phase, which
Right.
is like, oh, resting. Well, resting is when your hair falls. So it's like more,
Right.
a higher percentage of the hair is no longer growing, and it's more shifted into resting. And for some reason, it's like always 2 to 3 months to
Yes.
where that
It's
starts to happen,
interesting.
where you can notice it. So
Yep.
it's often not something that, okay, I did something yesterday and my hair loss started today, it must be this new
Right.
shampoo I'm using. It's usually something that occurred a couple months
Mm-hmm.
prior. Mhm.
Yes. Yeah. Totally. It's so fascinating.
Mm.
Yeah, when I learned that, I was just, wow, I had no idea. Nobody talks about that.
No.
So definitely something to consider if you're suddenly noticing hair loss, and, you might have had blood work and it came back normal. Think about lifestyle and think about life
Mhm.
events. Yep. Obviously the postpartum hair loss one, I remember reading, oh, like postpartum hair loss could start anywhere between like, I don't know, like 3 to 6 months or something, literally 3 months to the day after I had my son. This last one, I looked at my brush and I was like, damn it. Like it's starting
Yeah,
again. I was hoping, praying that maybe I would evade it
I
by some
know.
miracle. But yeah, it was just super, super intense. And yeah, the great thing about hair loss and acne is, as we know, and listening to this chat, and just following you on your social media, it's something that we have more control over than we think. So
Mhm.
let that empower you if you're
So
listening
true.
to this struggling, and you feel like you are just, there's nothing you can do, you've tried everything. There are definitely things that you might not have tried. Are there more like and I'm going to give you an example of this.
Okay.
Are there more like, I would say less conventional recommendations that you give women when it comes to skin and hair? And I'm going to tell you the one that comes to mind
Okay.
for me as an example is changing my shower filter. Like
Mm-hmm.
never would have realized that. But I really do. And I've only been using it for like 2-3 weeks, but I really do feel like it's made a difference. I am somebody who ever since I had my son, oh my God, pregnancy changes so much that we don't even think about. I started having eczema after I had my son for the first time
Interesting.
ever. And I could not figure it out. I did a lot of work in my gut health. That was helpful. But I really feel like it's even impacted that, like my skin doesn't feel as itchy. And that
Mm-hmm.
was really cool. So that's what I mean by like unconventional,
Okay.
not the first
Yes.
thing you would think of.
Yes. First off, what shower filter did you
The
get?
one you recommended,
Hey, did you get Jolie?
the
Yeah.
Jolie, and it's gold and it's so cute and I love
I know.
it.
Okay, I'm so
Yeah.
glad. Yeah,
My
that was my
fiance is like,
favorite.
what is this? We have a shower filter. I was like, okay, let me explain.
It's better. It's
Yeah,
better.
it's
Yeah,
superior.
shower filter for skin
Oh,
and hair.
yes.
Totally. I love that recommendation. Silk
Hmm.
pillowcase for hair
That's my
loss.
next move. Yes.
Yes, silk
Hmm.
pillowcases are amazing. It helps prevent the excess friction and pulling.
Yes.
And similar to sleeping, washing your pillowcases frequently for
Frequently.
acne. I
Mm.
also really love red light therapy, using
Mm.
red
Heard of
light
it.
for hair growth and for skin health.
So
For acne, you can
cool.
use a blue light rather than a red light.
Okay.
But yeah, I
Very
love
cool.
those few options.
Awesome. Those are great suggestions. And I want to double up on the silk pillowcase. I also
Yes.
changed my hair ties from like the
Hmm.
like grabby elastic to like the silk scrunchie.
Yeah,
I'm not
so
perfect.
good.
I don't wear them every day. Like
Hmm.
when I have this little bun action, I just use a regular one, but I love those. And I feel like they don't yank at my hair as much because I have very,
Yes.
very, very fine hair. I always have. So I'm always like,
Yep.
break it off.
Yep.
Yes.
I'm the same. Hmm.
Awesome. Those are great tips. So before we wrap up, I would love to know how you work with clients, how you work with women. I know you're probably taking a nice leave for a little bit.
Yeah.
But how can listeners, where do they find you? How can they work with you? I just think you're such a wealth of knowledge and I definitely want to connect listeners and followers to you. So lay it on us. How can they
Thank
find you? How do
you.
you work with clients? Yeah.
Thank you. Okay, so main places where I'm active every day is TikTok and Instagram, and that's
Okay.
Kara Clark BSN on
Cool.
both accounts. Working with people, I don't do one-on-ones, but I did create online courses
Cool.
for hormonal acne and hair loss. So for acne,
Awesome.
that's my Acne Killers Academy. And for hair
Mm.
loss, it's called Hair Growth Goddess. And it's basically everything that I would teach in a one-on-one session, but it allows someone to go through step by step and create their
Yes.
perfect routine for
Oh, I love
themselves.
that.
So
That's so perfect.
that's
So it's like
great.
customizable kind of.
Yes, it's
So cool.
customizable. You can take it at your own pace.
Love it.
You can find that through my accounts. And by the time this podcast comes out, I should have
Hmm.
my new website
Cool.
up. I haven't had a
Exciting.
website like all year. And
Nice.
my
One thing
little
at a time.
sister is a web designer and she helped
Oh,
me create
perf.
this beautiful website, all thanks to
Yay.
her. So that should be up
Good.
soon. And then I've been
Cool.
starting YouTube recently, and that's been
Yes.
really fun.
Awesome.
So far, I've just been posting lifestyle and some pregnancy content, but I'm
Yeah.
planning on doing more beauty and skincare and health
Cool.
content there.
So
And
needed.
then message me. Anyone can always message me. I get a lot of messages and I'm really bad at responding, but I really try to. So you can always
Yes.
message me if you have any question or need skincare recommendations or tips or
Awesome.
advice or anything.
Oh, great. Fabulous. Yay, good. Oh my gosh, thank you so much for your time. This was such a
Yes.
great chat. And I feel like, again, just so needed, as women and boosting our confidence and helping us figure out,
Mhm.
how do we get to where we want to go with our skin and our hair. So needed.
Yay. I'm so glad.
Thank
Thanks for having me.
you.
It was so much fun.
All right. Thanks, Claire.